Hey everybody, this is Adam from Choices Clinical Counseling. I just wanted to talk about something with you that I think is pretty important. It's called the window of tolerance. This is really important because in sessions up here when people come in, I quickly want to figure out what they can handle. Some people can handle a little more, some people can handle a little less. When you think about it, you want to kind of use the analogy of a window. So if a window is open this much, you can handle about this much of trauma. A little bit more, you can handle more, and it keeps getting bigger as you discuss the topic. Particularly when I'm doing EMDR sessions, which is the eye movement desensitization and reprocessing therapy. We're trained early on to gauge what people can handle and what they can. And if there's an area that they can't handle, we got to work on some skills to increase that ability, which would be mindfulness, breathing techniques, and a variety of other things that I use. So when you come in, I try to figure out what you can handle. So typically when people first come in, if there's a large degree of trauma, their window of tolerance is about like this. So they can't handle a lot. So what do I want to do? I want to increase it. So whenever they can handle more, we can talk about more, process it better, and they can retain it. Some symptoms you see whenever you're working in this and you're working outside of the window of tolerance is on the upper end. It would be anxiety, panic, irritability during sessions. Some people just get overwhelmed, some panic type symptoms. On the low end, it's more depression, kind of numb, feeling out of it. So whenever those symptoms occur, I have to be very aware of that. And you should be aware of that in your own life also. You don't want to let those things go on for long periods of time. We want to increase the window of tolerance. We want to make you be able to tolerate more difficult subject matter. One thing that people do when they first come in is they want to tell me everything. They want me to know their entire background and every bad, horrible thing that's ever happened to them. I don't necessarily want to know that right off the bat. I can kind of get an idea in a variety of ways of what's actually going on. So when you first go into a counseling session, or you don't want to just come in and just dump everything out. We want to do it gradual. And I've talked about this before, but we want to look at this more as I'm more like a personal trainer. We gradually increase the difficulty level during sessions so you can handle more. When you go for your first session with a personal trainer, you don't bench 300 pounds. You start out with 50 and then 75 and then 100, and you keep gradually moving up. I want people to be successful. I want them to leave a session and feel like they got something out of it, that they feel like they can tolerate more in their own life, or they can handle experiences that previously were very, very difficult for them. So you first come in and you're dealing with something traumatic, slow is key, gradual is key, not a whole bunch at once. So think of the window of tolerance. If you're out in your personal life and somebody brings up a subject that's kind of rough for you and you feel anxiety coming on, or you can feel the opposite. You can feel depression and you feel down and maybe some sadness starts creeping in. You may be outside of the window of tolerance of what you can actually handle. So to sum up, stay within that, and if you're outside of it, you do some soul searching and you figure out why. Is there something from your past? Is there something from your childhood? Is there something that you just haven't worked through yet? So thanks for watching. If you like it, feel free to share. Thanks for your time.